everyone, I am Dr. Sila and this is Dr. Sila Biolabs. Here we make science simple, exciting and unforgettable. So let's join and explore together.
Welcome. Today we'll discover the science behind teeth whitening and brighter smiles. Why do some teeth stay white while others slowly become yellow or brown? Your tooth has layers, and their natural colors shape your smile. Enamel is translucent, while dentin underneath naturally has a yellow shade. Genetics affect tooth color, so not everyone starts with the same shade. Daily habits slowly add stains that can darken your teeth. But can whitening remove every stain? The answer may surprise you. Let's explore what whitening is, how it works, and whether it's safe. Did you know? Perfectly healthy teeth aren't naturally paper white. The outer layer, enamel, is strong but slightly transparent. Beneath enamel lies dentin, which naturally has a yellow color. The color you see is a blend of enamel and the dentin below. Healthy teeth come in many natural shades, and that's completely normal. And one person's natural white may look very different from another's. Your genes help determine the natural brightness of your teeth. And our teeth naturally change color as we grow older. When we're young, enamel is thicker and reflects more light. Years of chewing slowly wear down the enamel surface. As enamel thins, the yellow dentin underneath shows through. Over time, teeth also absorb more pigments from food and drinks. A darker smile with age is often a normal biological change. Fortunately, many age-related stains can be safely reduced. Next, let's uncover the everyday habits that stain our teeth. What causes tooth stains? Every day, tiny pigments stick to our teeth and cause staining. Coffee is one of the most common causes of surface stains. Tea contains natural compounds that can gradually darken enamel. Smoking covers teeth with tar and nicotine, creating stubborn stains. Dark beverages leave pigments that cling tightly to tooth surfaces. Certain foods can also contribute to gradual tooth discoloration. Some stains stay on the surface, while others sink deeper into teeth. Next, we'll learn the difference between surface and deep tooth stains. Not all stains are the same. Dentists classify them into two main types. Extrinsic stains form on the outer surface of your teeth. Coffee, tea, tobacco, and dark drinks commonly cause these surface stains. Many surface stains can improve with cleaning and professional whitening. Intrinsic stains develop inside the tooth, beneath the enamel. Aging, trauma, and certain medicines can create deep internal stains. Deep stains are harder to treat and may need stronger whitening methods. Next, we'll uncover why smoking creates some of dentistry's toughest stains. Smoking is one of the fastest ways to stain healthy teeth. Tobacco smoke carries sticky chemicals that cling to enamel. Nicotine and tar work together to create stubborn yellow and brown stains. The longer you smoke, the deeper and darker these stains become. Many tobacco products can stain teeth, not just cigarettes. Smoking also increases plaque and tartar, making stains even worse. Surface stains can improve, but deeper tobacco stains are harder to remove. Next, let's meet the everyday drinks that silently stain our smiles. Some of our favorite drinks can slowly change the color of our teeth. Eyes. Coffee contains dark pigments that easily attach to tooth surfaces. Eyes. Coffee contains dark pigments that easily attach to tooth surfaces. Tea can stain teeth just as much, or even more, than coffee. Red wine combines strong color and acidity, a perfect recipe for stains. Soft drinks add pigments and acids that make staining easier. And alcohol can dry the mouth, reducing saliva's natural cleaning action. Simple habits, like drinking water, can help reduce staining. But drinks aren't alone. Many everyday foods can stain teeth too. It's not just drinks. Many everyday foods can stain our teeth. Dark berries contain natural pigments that may leave surface stains. And turmeric and richly colored spices can gradually discolor teeth. Dark sauces can cling to enamel and add stubborn stains. Brightly colored foods may contribute to gradual tooth staining. Sticky foods keep color pigments in contact with teeth for longer. Water and crunchy fruits can help wash away leftover food particles. Next, we'll explore hidden causes of tooth discoloration beyond food and drinks. Next, we'll explore hidden causes of tooth discoloration beyond food and drinks. Sometimes, tooth discoloration starts from within, not from food or drinks. Certain medicines taken during tooth development can cause permanent staining. An injured tooth may slowly turn gray or dark after trauma. A damaged nerve can change the tooth's color from the inside. Too much fluoride during childhood can create white or brown marks. Some older dental materials may also affect tooth appearance. Internal stains often need different treatments than simple surface stains. Next, let's discover what teeth whitening really is and how it works. So, What exactly is teeth whitening? Let's clear up the confusion. Teeth whitening is the process of making teeth look brighter and cleaner. It works by reducing stains that have built up over time. The goal is to lighten your natural tooth color, not create artificial teeth. Sa best barid wilbur. There are professional and home methods for whitening teeth. But is whitening the same as bleaching? Not exactly. And next, we'll explore the science of dental bleaching and how it really works. Teeth bleaching uses special chemicals to lighten deep stains. The most common bleaching ingredient is hydrogen peroxide. Carbamide peroxide breaks apart into smaller molecules. Another option is carbamide peroxide, which works more gradually. These agents release oxygen that breaks down stain molecules. They work beneath the surface, not just on the outside of teeth. Large dark pigments become smaller, making teeth appear brighter. When used correctly, bleaching targets stains while preserving healthy tooth structure. Next, let's step into the clinic for professional teeth bleaching. Walk into any store, and you'll find dozens of whitening products. But are they all effective? Let's compare the most popular options. Custom trays are made to fit your teeth for even whitening. Whitening strips are simple to use and can improve mild stains. Home kits vary widely, so results depend on their ingredients. No product works the same for every type of tooth stain. More isn't better. Overuse can lead to tooth sensitivity. Next, we'll uncover the truth about LED and laser whitening. Blue lights, red lasers, but do they actually whiten your teeth? Advertisements promise miracle results, but science tells a deeper story. The whitening gel does the main work of removing stains. The light may help activate some systems and improve the process. Many whitening treatments can work even without special lights. Lasers and LEDs are different technologies, but both rely on whitening gel. The goal is a healthy, natural smile, not an unrealistic shade. But what about viral whitening hacks? Let's separate fact from fiction. Millions watch whitening hacks online. But do they actually work? Charcoal may remove some stains, but excessive abrasion can wear enamel. Baking soda can polish surface stains, but won't bleach deep discoloration. Popular natural remedies lack strong evidence for significant whitening. Safe dental whitening offers more reliable and consistent results. The safest whitening plan protects your enamel while reducing stains. But even safe whitening can have side effects. Let's talk about them. Teeth whitening is popular, but is it completely safe for everyone? The most common side effect is temporary tooth sensitivity. Temporary tooth sensitivity. And intrac and densdevalvering. Whitening gels can temporarily irritate the gums if misused. Using whitening too often can increase sensitivity without improving results. Some dental problems should be treated before starting whitening. A dental checkup helps determine if whitening is right for you. When used correctly, professional whitening is designed to protect healthy teeth. So how do you keep teeth white after treatment? That's next. Here's the truth. Whitening doesn't last forever. Old habits can slowly bring stains back to your smile. A simple glass of water can help reduce leftover staining pigments. Geen Jeffer van Flossings. Good brushing and flossing help keep new stains under control. Regular dental cleanings remove many surface stains before they build up. Extension of hard years. Small daily choices can make whitening results last much longer. Occasional touch-ups may help maintain your desired tooth shade. Still have questions? Let's answer the biggest whitening myths next. Many yellow teeth respond well to whitening, but every smile is unique. I've heard these questions thousands of times. Let's answer them. Whitening changes natural teeth, but not crowns, veneers, or fillings. Professional whitening is designed to brighten teeth while preserving healthy enamel. Results vary because stains and natural tooth colors are different. The best whitening plan starts with a dental checkup. The best whitening plan starts with a dental checkup. One final chapter remains, the complete guide to a lifetime of brighter smiles. We've uncovered the complete science behind a brighter, healthier smile. Most stains come from everyday habits we often don't notice. Understanding your type of stain helps choose the right treatment. Professional guidance makes whitening safer and more predictable. Daily care and healthy habits help keep your smile bright. The goal isn't perfect white teeth. It's a healthy, natural-looking smile. Confidence begins with knowledge, prevention, and caring for your oral health. Thank you for watching Dr. Sila Biolabs. Subscribe for more evidence-based dentistry, and remember, every healthy smile tells a beautiful story. Thank you for watching Dr. Sila Biolabs. Subscribe for more evidence-based dentistry, and remember, every healthy smile tells a beautiful story. If you enjoyed this video, subscribe to Dr. Sila Biolabs. Every subscription supports our mission to help cancer patients through education and charitable initiatives. One click can make a difference. Subscribe to Dr. Sila Biolabs and help us support cancer patients through our mission.